Hello everyone. You have a headache, so you reach for an ibuprofen. You have some muscle pain after a workout, so you take a naproxen. Your doctor has you on a daily pill for heartburn. These actions seem completely harmless, a normal part of modern life. But what if I told you that for someone with diabetes, some of these everyday over-the-counter medications could be silently harming one of your most vital organ systems, your kidneys? Today, we are going to have a very serious and very important conversation. We're going to talk about common medications and substances that can be toxic to the kidneys, a term we call nephrotoxic. And we're going to discuss why the diabetic kidney is uniquely vulnerable. Hello everyone, I'm Dr. Frank Maxwell, and welcome to Diabetes Medic, your source for clear, evidence-based health information. Now, I want to address the title of this video head-on. The word destroy is very strong, and I chose it intentionally to get your attention. Let me be absolutely clear. This video is not designed to create fear or to tell you to stop taking your medications. Its purpose is to create awareness. The truth is, these drugs don't automatically harm the kidneys in every single person. But they do carry risks, especially with long-term use, high doses, dehydration, or in the presence of pre-existing kidney issues. My promise to you today is to give you the critical information you need to use these common drugs safely. You will leave this video empowered to protect your kidneys and have a more intelligent conversation with your own doctor. Let's get straight into the list. 1. NSAIDs, non-steroidal anti-inflammatory drugs. What they are. This is arguably the most common and most important class of drugs on our list. I'm talking about over-the-counter pain relievers like ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen. Why you might take them? For just about any ache or pain, headaches, arthritis, muscle soreness, menstrual cramps. How they can harm the kidneys. Your kidneys are a dense network of tiny blood vessels that filter your blood. To stay healthy, they need strong, steady blood flow. NSAIDs work by blocking prostaglandins, but these same prostaglandins are responsible for keeping the blood vessels that supply the kidneys wide open. When you take an NSAID, it can cause these vessels to constrict, reducing blood flow to the kidneys. In a healthy person, this is usually not a problem for short-term use. But in a diabetic kidney that may already have some compromise, or with long-term high-dose use, this can lead to acute kidney injury. The doctor's advice. For occasional mild pain, consider starting with acetaminophen, Tylenol, as it does not affect kidney blood flow in the same way. If you need an NSAID, use the lowest effective dose for the shortest possible time. If you have chronic pain, talk to your doctor about safer long-term strategies. Never use NSAIDs if you are dehydrated. 2. Proton pump inhibitors, PPIs. What they are. These are extremely common medications used to treat acid reflux, GERD, and heartburn. The most well-known are omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. Why you might take them for chronic heartburn and acid reflux symptoms. How they can harm the kidneys. While PPIs are generally safe in the short term, multiple large-scale studies have linked their long-term use over years to an increased risk of developing chronic kidney disease. The primary mechanism is believed to be a condition called acute interstitial nephritis, which is a type of allergic inflammation in the kidney tissue that can lead to scarring and permanent damage over time. The doctor's advice. PPIs can be lifesavers for certain conditions, but they should not be used indefinitely without a clear medical reason. If you've been on a PPI for more than a few months, have a conversation with your doctor. Ask the question, do I still need to be on this medication, or can we explore other options or lifestyle changes? Answer 3. Certain antibiotics. What they are. Not all antibiotics are a problem, but certain classes are known to be potentially nephrotoxic, especially at high doses or in a hospital setting. The classic examples are the aminoglycoside class, like gentamicin, and the powerful antibiotic vancomycin. Even common antibiotics like sulfa drugs and ciprofloxacin can pose a risk in rare cases. Why you might take them: for serious bacterial infections, how they can harm the kidneys. These drugs can directly damage the delicate tubules and filtering units, glomeruli, within the kidneys as they are being processed and excreted. The doctor's advice: you should never avoid an antibiotic that is necessary to treat a serious infection. However, you should be your own advocate. When your doctor prescribes a new antibiotic, it's always wise to ask, is this medication safe for my kidneys? And to ensure you stay very well hydrated during the course of treatment. We're about halfway through. Before we continue, I want to hear from you in the comments. Which of these so far has been the most surprising to you? Is it a medication that you or a family member uses regularly? Let's discuss it. 4. Contrast dyes for medical imaging. What they are. This isn't a drug you take at home, but a substance you're given in a hospital or imaging center before certain types of scans like a CT scan or an angiogram. This iodine-based dye helps make your blood vessels and organs visible on the scan. Why you might get it: to check for blockages in the arteries of your heart, legs, or to get a detailed look at your organs. How it can harm the kidneys. The dye is filtered out by the kidneys, and in some people, especially those with pre-existing diabetes or kidney disease, this process can cause a rapid decline in kidney function known as contrast-induced nephropathy. The doctor's advice: your radiologist will almost always check your kidney function with a blood test before giving you contrast dye, but you must be proactive. Always inform the doctor ordering the scan and the technologist performing it that you have diabetes. They can take extra precautions, like hydrating you with an IV drip before and after the procedure to protect your kidneys. 5. Mismanagement of diuretics. Water pills. What they are. These are common blood pressure medications like hydrochlorothiazide, HCTZ, or furosemide, Lasix. Why you might take them: for high blood pressure or to treat fluid retention, edema. How they can harm the kidneys. Diuretics themselves are not directly toxic. The danger comes from their effect. They make you urinate more to remove excess fluid and lower blood pressure. However, if you become dehydrated due to a stomach bug, excessive sweating in hot weather, or simply not drinking enough water, taking a diuretic can put severe stress on your kidneys, leading to acute injury. The doctor's advice: if you take a diuretic, hydration is non-negotiable. You must be diligent about drinking enough water every day. If you have any illness that causes vomiting or diarrhea, call your doctor. They may advise you to temporarily hold your diuretic for a day or two until you are rehydrated. 6. Certain herbal supplements. What they are. This is a huge category. Many people assume that because a product is natural, it must be safe. This can be a dangerous assumption. Some herbal supplements, especially those from unregulated sources, can contain heavy metals or have direct toxic effects on the kidneys. A classic example is any supplement containing aristolochic acid, which is a known nephrotoxin. Why you might take them. For a wide variety of health reasons, often without a doctor's recommendation. How they can harm the kidneys. They can cause direct cellular damage, inflammation, or interact with your prescription medications in harmful ways. The doctor's advice: this is simple and absolute. You must tell your doctor about every single supplement, herb, and tea you're taking. Do not assume they are harmless. Your doctor needs the full picture to keep you safe. 7. Your own diabetes medications, if not monitored properly. What it is. This is the most nuanced point. Drugs like metformin or the newer SGLT2 inhibitors, like Jardiance or Farxiga, are actually kidney protective in the long run. The danger. The risk arises if your kidney function has already declined significantly and the dose is not adjusted. For example, metformin is cleared by the kidneys. If your kidney function drops below a certain level, the drug can build up in your system, increasing the risk of the rare but serious side effect, lactic acidosis. The doctor's advice: this highlights the critical importance of regular checkups. Your doctor should be checking your kidney function, your GFR and creatinine levels, at least once a year. This allows them to adjust the doses of your diabetes medications to match your kidney's current capacity, ensuring that these helpful drugs remain safe for you. My final clinical takeaway: the common theme through all of these points is not that drugs are bad. The theme is communication and awareness. Your job as a patient is not to be your own pharmacist, but to be an informed partner in your healthcare. Protecting your kidneys is one of the most important things you can do when managing diabetes. This isn't about being afraid of medication, it's about being smart, cautious, and proactive. Be the CEO of your health and be the guardian of your kidneys. If this deep dive has empowered you with new knowledge to protect yourself, then I invite you to hit that subscribe button and ring the notification bell. Join us here at Diabetes Medic for more information that puts you in the driver's seat. For today's question, what is the single biggest takeaway for you from this video? What is one thing you will do differently starting now? Share it in the comments. Thank you for being here today. Now that you know about the external things that can harm your kidneys, it's crucial to be able to recognize your body's own internal warning signs. I highly recommend you watch the video on the screen now. 5 warning signs your kidneys are in trouble. It's the perfect follow-up. Click on it, and I'll see you over there.